Welcome to this new episode of the Panel Fit Monthly Chat. Today we have Sara Judite Mendes Roda. I hope
it's just Sara Roda, that would be okay.
Yeah, Sara, okay. She's a PhD researcher on digital health surveillance at the University of Brussels. And she's a senior policy advisor in Digital Health Life at the Standing Committee of European Doctors. And today we'll address some some topics that are very on the news in these days, which are mainly on digital rights and data protection at the age of coronavirus. I would say let's start from the very beginning of the questions we prepared. And one is about a topic who's on the news in these days, but it's still not that clear how much relevant is this issue actually. But I mean, there are some issues related, and it's about this contact tracing app and the contact tracing protocol that is being developed in Europe. And we see European Union is trying to develop a standardized protocol for developing not one single app, but different apps in different countries, but with a standardized approach. So, and of course, Apple and Google hit the floor announcing an unprecedented partnership to make a Bluetooth-based tracking app work on both devices. So just what's your point of view on all this?
Thank you, Federico, and thank you also, first of all, for inviting me to this panel fit. I was really happy to be here. And as you said, I'm working at the Standing Committee of European Doctors, which is an association that represents the national medical associations across Europe. And they are also very engaged in this topic, and because they are working in the area of the e-health file. It's the e-health file. And so regarding your question, just before I just would make a little bit of a context point. I think the contact tracing relates is a tool that health systems are using and should not be seen as the only one. And especially, so when you want to control a pandemic as this one, this should be another tool and not the only one. And we should not focus only on this point. So it should complement other public health measures. So this would be my first point. Then the fact that contact tracing we can question their efficiency also, because as the rules have been issued by several entities, so the European Data Protection Board and also the Commission has issued some guidance on the creation of these contact tracing tools. Their efficiency can be severely undermined because they are on a voluntary basis, and rightly so, because we don't want certain kind of situation in Europe regarding contact tracing and enforcement and so on, but we see some divergences between member states. But the fact that they are on a voluntary basis, and the fact that they are on an app that we can have easily disconnect our phone or be out of net connection and so on. So the efficiency of these contact tracing apps is indeed limited. Then, regarding your question, it reveals a little bit the approach that member states are having. So, and we can have two different scenarios. You have some member states that are following this centralized approach and another one on this decentralized approach. And the protocols that are coming up from Apple and Google, they are more for the decentralized approach. And we see this is not the only protocol. There are two others, and they are all being made in open source, which is very positive, because there are so many technicalities that a person with an academic of a law background cannot go into detail and to see actually, unless you are there, with the developer and see how they are and what kind of data they are collecting, it's very difficult from the backlines to see how the app is being developed in a correct way. So these two other protocols is the TCN coalition and the DP.3T from Carmela Troncoso. And the latter one, the DP/3T from this researcher, is being followed by certain member states. The majority, in fact, are having the option of having this decentralized approach instead of a centralized one, which is being preferred by France, for example, UK, and I think Australia. And so, well, I think it's in terms of privacy concerns, they are opting indeed for more a decentralized approach. And we see that the fact that Apple and Google on the one side have decided to unite to bring forward, we can see some positive aspects and negative aspects. The positive aspects is that they are very nodulable entities. They know what they are doing. They can create something good. But the fact that in this day they are private entities, we have to make sure that we have other safeguards to ensure that the data that will be collected will be in accordance with what is said in the privacy policy. So we have to make sure that the contact app has privacy policies that are accurate, updated, which is normally not the case, and that they really do what they say. This was the first general comment to your question.
Yeah, a lot of different issues here already. And yeah, of course, there's I see maybe, I'm asking you if there's a problem when big companies propose and or impose a technical solution when an European discussion is about to happen. I mean, from them is a way maybe to solve some problems that wouldn't be possible to solve independently from states, from single app developers. But at the same time, they are somehow imposing a standard that will be on the phones of millions of people. So what's your point of view on this?
Well, it's true, but now technology is much more lean by what this industry is developing. So unless we have a better solution and an independent one, and we see some countries doing their own contact tracing apps, it's something that I don't know. And with the pressing of time, is something that we cannot really escape, and we have to have what I think is also for maintaining these kind of structures and to see for the future that there is some kind of independence overview on what is being done. So it's true that they will model the future of this kind of contact tracing apps, and but we see that they are not the only alternatives. So we have these two other protocols in open source that are available, which is very positive, and you can really learn from those protocols. So they are in GitHub, and constant discussions are being made on those.
Okay. Yeah, let's, as you said in the introduction, contact tracing apps are not the only, and maybe are not the main tool to address an epidemiological study on what's happening in Europe with the pandemic. But the use of health data in general is a powerful tool, I would say. I mean, with health data in general, you can help medical community develop strategies and treatments against the virus. Besides,
there is a background.
Yeah, no problem. I mean, we are all working from home, so
okay.
Yeah, I would like to ask you, what's the ongoing debate around this topic, this more general topic on health data and treatments strategies for the virus?
Yes, it's not been clear for the community, especially in relation with the sharing of health data. I think researchers are in a little bit of difficulties to understand what can be shared and not, and the new regulation for them, it's not an easy piece of law, easy to understand. And we see also the sharing of health data across borders has been suffered some has retreat for a while, especially with the United States, when there was no possibility to share health data and to advance. So the European Union is trying to move forward and to see how this is done, because, as you know, in order to transfer data, to share data, you need to have an adequate decision to transfer the data outside the EU. You need an adequate decision from the Commission, and in the United States this is not the case. Then you need to have strong safeguards implemented, or you use the derogations. And so for the derogations, it's quite specific, because you have to have some, for example, you can submit some contract clauses, standard contractual clauses that are approved by the data protection authorities and the entity with negotiating, but this is still very unclear and how to do so. The sharing of health data, it's not been easy for the community to do it and to work, and also because you have a specific method and a specific way to conduct research, and so you have the ethical, not only the legal rules, but the ethical standards to do so. And even, for example, giving the case of consent, you normally, it's ethically correct, you have to collect consent from the participant to a specific research. But in case of processing personal data, you can have, of course, other legal basis to process personal data from the data participants. So there you have to collect different, you have to have different forms and procedures for one thing and another. And in the context, for example, of employment, I could just briefly mention that because of this hierarchical relationship that the employee has versus the employer, the free consent cannot be presumed. So you have to have other safeguards to make sure that you always collect the consent of the user. And if you think of research, for example, in terms of robotics, where you have to have specific, you have to use the employees to try to implement or to test the technology that is being developed. There can be some tensions on having the consent of the worker that is on a daily basis using the technology, and to make sure that that consent is really free. So the solution is to have, for example, an independent reviewer that is there to collect the consent. But I think I escape a little bit on your question.
Yeah.
So just to sum up, yes, the health, the conducting research and to share information and the use of the GDPR for health research has not been easy to accommodate.
Yeah, actually, I will ask you about GDPR and national laws on this matter. I mean, it has been said that GDPR is being a powerful tool to enforce the respect of personal, the handling of personal data in a proper manner in general in Europe, and is an example also for countries outside Europe. But I was wondering if in this very occasion it is being an empowering tool, or maybe it is complicating, let's say, the situation, And on the contrary, if national laws that still somehow apply and have, national states have some discretionality on some areas of data protection, if these are hindering the process of sharing of health data for epidemiological studies.
Well, you have now a recent guideline from the European Data Protection Board on the processing of health data for scientific research and relating to the COVID outbreak, which was recently from 21 of April. And there they discuss in depth all the legal basis and the how to safeguard the data subject rights and the appropriate safeguards that should also exist. And I think what is indeed tricky, because you have research is something that member states can legislate further. So the General Data Protection Regulation is the general rule, and they allow certain, for example, as a legal basis to process data further. So you have the distinction between primary use and secondary use of health data for doing research. And normally what happens is researchers want to use further health data for other projects. So you collect for a specific purpose, and then you want to use it for other issues. The GDPR allows you some derogations in this area, and is foreseen in articles that you can do this. But member states, there can be further exceptions foreseen by member states' law. And you saw that some member states are still adjusting their regulations to this new requirement from the GDPR. I know, for example, the case of Portugal, they were still discussing what kind of derogations there could be for scientific research. And this is something, for example, that the Standing Committee of European Doctors is very concerned about, the secondary use of health data for research. So we say that there needs to be a code of conduct established for secondary use of health data, a European one, to have some basic principles on this. And one of the main key issues is to have some kind of independent review boards or ethic review boards. When you no longer have consent as your legal basis to process data, then you have to make sure that there is another entity, an external entity, to oversee what is happening with the data that you are collecting. If you do all the safeguards and if your method is in really privacy friendly and respectful of data protection rights. Yes. So
yeah, I guess it's being a bit tricky now, because among the exceptions of the GDPR, if I'm not wrong, yes, there is the possibility to skip consent in case of emergency for a public goal, let's say. So in this case, I guess it's even more tricky to assess what's the secondary use that you are allowed to do of this data, given that you didn't have consent at first. So now, I mean, are you authorized to do a secondary use of those data?
Yes. So there you have Article 89, where they have further specifications on this. And so first, you should have whenever you can, you should remove all identifiers from data subject. So you have to, if you can anonymize and it's not in detrimental to your research, you should do this. If not, you have to pseudonymize and make sure that other safeguards are there. So particularly if a data subject wants to exercise their rights, they are able to do so. But here again, it's where some exceptions can exist also at national level. You can have certain derogations, and you may not be able to exercise your rights. But also very important are Articles 14 of the GDPR, where you have when you are no longer collecting information or personal data from the data subject, you have to make sure that you comply with the information on Article 14. And then you have again some further exceptions. And so this is becoming a rule. But yeah, but you can foresee and some derogations on the and certain restrictions. But the European Court of Justice has said that you have to the restrictions should be applied when you do restrict data subject rights when they are strictly necessary. So we always have to make this balance of interest and proportionality between your actions and the impact that you can have on a data subject. Especially here in terms of employment, when you are dealing with health data of an individual, you really have to make sure that you don't that your actions do not lead to discrimination and that you don't breach their privacy of your employee, and that they are not afraid to seek, for example, treatment in case of some. In case of their diagnosis of COVID, for example.
Yeah. Let's move to the employment side of the topic. So that you already introduced. I would start with the gradual reopening of industries, schools, and shops that is happening right in these days in different countries. According to a report by the European Agency for Fundamental Rights, many employers turn to DPAs for advice on the legal requirements relating to the collection and processing of employees' health data. And it turned out that DPAs of different countries are divided regarding the possibility to disclose the identity of infected staff. So what are the implication of such disclosures for employees?
Yes, so I think having this, I just wanted to add something about the contact tracing app that I had forgot, because one of the things that are developing is, and I apologize for going back because I just remember that I wanted to mention this, is these contact tracing apps, they can have different functionalities. And one of the guidance from the data protection authorities was to make sure that they don't bundle together the functionalities of the contact tracing apps, which can have 4 kinds. So they can be for information, symptom checker, contact tracing, and warnings. So this is also important that certain safeguards concerning the contact tracing apps are indeed maintained. And I apologize because I had this thing in my head and I wanted, because I was also concerned with the fact when you know that a patient or in this case an employee has or if he's forced to have the contact tracing app to go back to work. Is this legal? Is this not legal? Can the employer collect information about their temperature or not? Can they know about their movements, if they can go abroad or not? And I was always thinking when I was doing and preparing for your questions, if there would be a record of time and place when a person if they have the contact tracing app, and if they record the time and place of the person when they were infected, so that they can get words. And there is clear guidance, at least in the decentralized apps, that people are not aware of this, that there is a lapse of time when you should be informed about this possibility of risk of infection. Because otherwise, but this does not always work. In for example, in Portugal, you have very small communities, and you basically sometimes know everyone, and you can easily identify someone. And with this, you can bring legal, you can have lawsuits, for example, with people, that they infected you. Because of this, you had expenses, medical expenses. Could this generate some lawsuits because you already you know who infected you? There was also a case in Portugal where people were aware who had infected everyone in the north, and the person had severe, some kinds of death threats, and yeah, there were threats to their, violent threats to their physical integrity. And there is also this, for example, for doctors, actually, when there are violence reports that people are aggressing doctors because fear of getting infected by the disease. And I think in Italy this is also a case, something that is appearing a lot, which is very regrettable. And also because we all know about the shortages of equipment, and they are risking their lives, and we have all these different situations. But well, this was just a brief parenthesis, and I'll go back to your question. So yes, I think when in terms of processing of health data and the use of health data by employers and the risks that this could have for employers, basically is you can have normally employers should not have access to the health data. You use an occupational health expert, and he is the one that should have access to this health information. And that person can tell you if the worker is apt or not apt to work. So it, of course, depends on national legislation. Labor law is different in each member state. So again, the GDPR has a general article about the processing of personal data in the context of employment, Article 88, but you have a lot of derogations that can happen at national member states. So the main thing in the safeguards is you have to make sure that the subject we comply with their human dignity, their fundamental rights, so their autonomy. These are the basic principles that have to exist in the context of employment, but there can be, of course, national divergences on what can be done. And the fear is to have, if you know that an employee has COVID, there are fears of stigmatization, discrimination, or you even can get fired for it. So you have to make sure that this does not happen in a certain way. But then you have the ethical issues of how to deal with this with the other co-workers, and what kind of measures do you do? How do you balance this? And I can go on, but I don't know if you want to wait. I wait first your question.
No, actually, we are running out of time, so I will skip to the last question connected to the letter, which is.
But then maybe I can just refer for the national point of view on the employment. For example, we have the Portuguese Data Protection Authority. They already issued guidelines on this, on the use of health data for employment purposes. And one of the things that they say is that you cannot collect temperature from your workers. What you can do, you can have specific measures adopted. So you can demand your workers to intensify their hygiene measures, to wash their hands. You can adopt rules in terms of space and organization. So foresee distance, social distance. You can have their protective equipment as masks. But then again, if you really want to collect health data, you should have an independent person to do so. And then they use the figure of the health worker and the occupancy, because again, there is also fear that, for example, these contact tracings could track the performance of a worker. Could this seem to happen? Maybe not, but because this is only public health authorities who have access to the contact tracing app. But no,
it's a potential risk among others.
Yep.
So we have different positions and different approaches in different countries. So I would ask you the point of view of a CPME on this.
Well, basically, what CPME, what it's important is that contact tracing, in specific regards, contact tracing should be comply with confidentiality rules. So it's very important. It's also important that physicians are involved in the process to make sure where is the medical boundaries and when you want to use this app, for example, by healthcare workers. The consent rules are also in place, and that the system is secure, that they do not allow margin for abuse. And in case of secondary use of collected data, this must respect, of course, the primary use. If you collect it for these purposes, the secondary use should be related to that purpose. And if this is not the case, then you have to have someone, an ethics review board to foresee that you can indeed process for that other purpose, and you can still you are in complying with the public interest, because this is, again, public interest is a very vague and broad definition, and also scientific research is a little bit broad, and it should be understood in broad terms. So it can also involve private research funded by private entities. So we really need these ethic review boards, to independent ones, to check that the purpose when you start is there, and when you finish, and also during, you also comply with this. It's not only one time, it's regularly.
Mm-hmm. And about employment specifically, is there I mean, about what we were talking a couple of minutes ago, is there a particular position from CPME about how employers should behave on these issues, like as you said, collecting temperature or having an internal sanitary responsible? I don't know if there's a strong position on this from the CPME or.
Well, what CPMEs mention is, we of course are looking at the medical profession, and we are looking at physicians and how physicians work in their working environment. And of course there they have a lot of protocols, and they really know what to do. They just need to have their equipment given. And of course, when you have a doctor that is infected, they ethically, in their own code of conduct, they take the necessary measures to protect the others, and also to do this. So this is, they basically follow their ethical and considerations. So it's, but it's normally the medical profession is united in this regard.
Okay, so thank you, Sara. I don't see any questions in our pool, so I guess we can say goodbye. Thank you once more for joining us. Thank you to our audience for being here, and yeah, see you next time.
Thank you. It was a pleasure.
Thank you. Bye.
Bye.